Thanks for that great question. I really beg the journalists out there, we really need more stories that talk about how funding should be spent more appropriately. And it's not about construction. Those stories are so sexy. Those stories are so great to tell. Like, oh, the mayor, he wants to cut at the ceremony and it's like the ribbon and you've got this brand new thing. But the reality is that that's not what's getting long-term sustainable services to the poorest. And overwhelmingly, it is the poorest who lack services. So it's somehow about, like Christian said, going to schools and going to clinics and really finding out what government is doing and how people are changing behaviors and those smaller stories, so that donors and ultimately then policies will more focus on creating sustainable services and not new construction of new infrastructure, because that's just not what we need.
Also, I think it's very important to consider the hidden factors behind any policy or program. And what I mean by these hidden factors is, Emily touched a little bit about this. Governments tend to put a lot of joy and excitement on the hardware part, on the infrastructure part. But what about knowing what's happening on the ground? What are the social dynamics that are enabling these programs to be implemented more effective? Are communities participating, or are just receiving these programs in a parochial way? How can we understand community participation as means to sustain services, particularly in very remote areas where the poorest are more concentrated? These are important issues because the poorest are the ones that face the highest barriers to receive service. And therefore, we need to understand why current policies and even donor money is not reaching them effectively. What are the factors that are not enabling this set of policies, programs, and spending reaching at the same level that the highest quintiles of income are benefiting from? So for instance, why we see a big gap in service quality between different income cohorts when it should not be the case? That's a very important question to ask. Or why we see that many Eastern and Sub-Saharan African countries, the nutrition prevalence of their kids are practically stagnant and stable. It hasn't moved. Why that is happening, and why it's affecting more the poorest compared to non-poor?